Hello, beautiful people. Welcome to this week's episode of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. I'm your host and producer of the Montpelier Happy Hour, Olga Peters, and I want to welcome to the show three guests. Of course, regular contributor Emily Kornheiser, who's one of three representatives from the town of Brattleboro. Hello, Emily.
Good morning, Olga. Nice to see you.
Nice to see you too, bright and early. And starting with David Mickenberg, who is with the Drug Policy Alliance. Really glad to have you back on the show.
Thanks. Great to be here.
And then Daniel Quipp, who is a Selectboard member in Brattleboro. Hey, Daniel, is this your first time on the show?
It is, yeah. I feel like I've been aware of this show for a long time. I still don't think I should be on it. I merely represent myself. I am not the entire select board.
We actually have a caveat, which you might have heard before, Daniel, that in the second half about how we're all just here representing ourselves. But you, I think, were chair of the community radio station when we first started the show on Brattleboro Community Radio. So you are an early and beloved champion.
That's
Daniel helped me with a lot of audio issues early on. So thank you. Sir, I really appreciate it. And just so everyone knows, Emily and I are feeling a little nostalgic because we are coming up on our 250th episode here in a couple weeks, and we're planning something special. But yes, so thinking of the early days at WVEW is giving me warm fuzzies at the moment.
Congrats.
Thank you. But
yeah, we went to the Brattleboro Community Television Award ceremony a few days ago. Yes, recently. This week, we went to that together, Olga and I.
Yes.
And we saw Cor being celebrated for her many years of service as she leaves Brattleboro Community Television, and that was incredible. We also saw that clips from all of the other shows and production projects at Brattleboro Community Television and realized we really need to work on our sets a little bit. And we'll be thinking about that when we move into our 251st episode.
Definitely. And some of our sound, our sound quality needs to be worked on a little bit too. But that is actually not why we're here today.
No.
We are here today to talk about substance use disorder and some of the approaches that are being used in Vermont, and to talk about community impacts, and are we using approaches that are actually helping, or are they creating more barriers perhaps? And I would like to start with, I think substance use disorder is something that people have a reaction to because they each kind of stand in their own place and view it from whatever their lived experience is. Or I was sharing before the show, I was talking to a friend last night in preparation for this show, and while I was looking at policy, she was just like, I just want there to stop being needles on the ground. Like, I just want people to pick up after themselves. And that kind of strong reaction, I think, is what a lot of people bring to this conversation, for better or for worse. And so I'm curious, I'd love to hear from each of you when you look out at the landscape of Vermont, and either through your lived experience or through policy or however you view it, what does our approach to substance use disorder look like, or how does it show up in your lives? Shall we, Daniel, would you mind starting with you, and we can work from like the ground up?
We can work from the least knowledgeable and expert to most. So let's see. For me, this issue is about people and about the impact on people. And what I have observed, and I do say observed, I actually don't have direct personal experience with this. And as a local select board member, it's an issue that shows up in ways that are really beyond the scope of the kind of things that we make decisions about typically. But what I've observed through my kind of time here, but also in other towns and cities, is the way in which our current kind of drug policies don't really help people. You know, I've seen the impact of like active addiction on people's family members, brothers, sisters, parents, children. And I've seen people struggle with that. And, you know, I have some personal experience about addiction and recovery myself, not from, you know, heroin or anything like that. It's from alcohol. And, you know, I feel like these days people don't really talk about alcohol and alcoholism in any kind of, I actually never hear about it. I used to go to AA meetings. I needed to go to AA meetings and they were helpful. And when I was in those rooms, and bearing in mind that the second A stands for anonymous, so I'm not going to talk about any, you know, specifics. But I've definitely heard people being in those rooms because they needed support around their drug addiction. And there was always a kind of a caveat, well, alcohol's a drug, you know, you're all welcome here. And, you know, so for me, it's about how people are harmed, how people are kind of pushed to the sidelines, how people are stigmatized, and that what we currently have is not working. You know, from my select board position, you know, I mostly hear about it from like a law enforcement end, or from a kind of like, in my neighborhood, there is a house where there's a lot of drug trafficking occurring, and that is causing our quality of life to be greatly diminished. That is true. And, you know, yeah, I think about the harm caused to people, and I would like to see that be reduced.
Thank you, Daniel. Emily, how about you?
Lately, I don't know if it's the weather or the conversations I'm having, but I just feel really overwhelmed by sort of the accident of circumstances that have kept me from having my life destroyed or severely impacted by drug addiction. I was visiting Turning Point a few weeks ago and talking to the director there, and just sort of remembering my own period of like really active and deep curiosity with substances, and some pretty unsafe behaviors, unsafe towards my own life. I don't think it was actually unsafe towards other people at that point. And how, like, you know, in my suburban childhood, I went looking for heroin. I thought it was like, you know, I was reading a lot of William Burroughs, and I just couldn't find any. And really how lucky I was in that, and how that wouldn't happen now. I would be able to find it if I was 17 and feeling curious, and wanting to sort of leave the experience I was having of sobriety. And I have a friend who actually grew up with in that sort of suburban experience, who also moved to Brattleboro to go to college around the same time, who sort of did find heroin in those suburban years, and really stayed quite safely in terms of impacts on, like, really strong impacts on other people through a lot of his life. You know, continued using opioids for decades. And it caused like great harm to his family in terms of his ability to show up fully emotionally, and probably, you know, impacts to his other pieces of his life. But it wasn't sort of the face that we think of when we think of sort of like needles in the park or, you know, a trap house. And he died of an overdose. He actually came on the show, and then died of an overdose a little bit after that. And then I think about the conversations that I had, that I have with the select board, that I have with folks living in Brattleboro, and what like the harms look like of substance use when there are huge economic consequences from it. when folks don't have somewhere safe to use, when folks are using in public. And so we, and there's not a safe place to put needles. So we see needles on the ground when there isn't someone available, like in the case of my friend David. And he, when he overdosed, when people aren't aware of when people aren't aware of what's in the drugs that they're using. And so there are unintended consequences to that. And when people don't have sort of the support they need when it gets to be too much. And so I'm just very aware lately of both like the luck of my own circumstances and privilege, and how so many of the harms that we are all grappling with sort of across Vermont, both in terms of like loved ones lost and unsafe playgrounds, how all of that is really linked to sort of the economic and law enforcement impacts and of unsafe supply. And that the part of it that I feel like we talk about the most is like the addiction part. Like that's sort of the same. It's like, it's the same as the alcohol part, or the other substances that people are, or gambling, or there's so many things people are addicted to that we don't see those same harms with. So anyway, that's what I'm like mulling over a lot this week as the seasons change.
I want to hear from David, but just quickly, I'll interject. I realize I was leaving myself out of this. My experience with substance misuse disorder has been of someone who hasn't used a substance but has had people in her life, and was usually the one who was impacted by it, and not always in positive ways. And so I always have to watch myself in these conversations. I have a certain level of fear and exhaustion of being harmed again. And so I know in these conversations, I sometimes have to be careful. I have to be careful with my own reactions, because I so want to protect myself from going back to some of the places that I went with friends and family. David, how about for you?
Lots of ideas, lots of thoughts. This is a great conversation. Thanks. I think it's funny because, we're looking, there's global issues and tragic loss of life everywhere. We're seeing mobilization around that. And one of the things I've been thinking about lately is that in the United States, we have 100,000 people dying a year of avoidable deaths. 100,000 people. In Vermont, we have the highest rate that we've had in a long time. 266 people died from avoidable overdose deaths, a 43% increase from the two-year period previously. We have a crisis, a healthcare crisis that is happening everywhere. And the sad thing about it is that it feels like because of fear, because of these quality of life issues, that we are returning to policies or attempting to return to policies or having conversations about policies that have just failed. And so, it's really, I guess I've been doing this work in Vermont long enough. There was a time in Vermont, and I was working on these issues, when we had no methadone treatment, no Suboxone, no hub and spoke, no naloxone, no needle exchange. And those were policy decisions that people were making. The legislature, the governor at the time, Howard Dean. There was resistance to harm reduction because there was a feeling that sort of, these people need to just do better. And we're seeing some of that rhetoric and language now. I live in Burlington, and I'm shocked to hear, friends of mine who are good sort of little p progressive people talking about, we just need to get these people away from us. And the thing is that if there was any evidence that supported that getting these people away from us somehow would be effective for their own safety and our safety, that's a conversation to have. There's just no evidence of that. The evidence is actually the opposite, that further criminalization and punishment and stigmatization causes harm and causes an unsafe community. And so I think we're at this really interesting point here in Vermont. We've been doing a lot since we had no methadone and Suboxone and needle exchange, and we've implemented programs. We're first state in the country to allow for naloxone over the counter. We've been doing a lot related to the hub and spoke model, and there's more to do. And so we've implemented policies. And the question now, it just sort of feels like we're at this point where, what direction are we going to go? Are we going to go back to a time when we thought the criminal justice system was the best way to deal with a medical condition? Substance use disorder is a medical condition. And if we think that filling prisons with people who are suffering from a medical condition makes sense, then we should be honest about that. I don't think that works. And I think the evidence is overwhelming that that doesn't work, and that actually criminalization causes more harm both to the individuals and to the community. And so I think that's the conversation we have to have. We have to take an evidence-based approach to what we're doing around policy. It's also interesting, something Daniel said around alcohol. There was a report that came out last year saying that there was a 36% increase in Vermont for alcohol-related deaths. Alcohol and tobacco are two probably the most deadly drugs that we consume in our state and in the country. Yet we are not having the same conversation about those people getting away from it. Like, we're not having the conversation saying we should be closing bars down because those people, when you consume alcohol, leads to bad things, whether it's violence or sexual assault or anything, all of the data that shows alcohol related problems. So I think we need to broaden the conversation to talk about, those people. It's all of us. We all consume substances of some sort, in the broadest definition, from coffee to meth, and they have impacts on our bodies. And once we can accept that that substances play a role in humans' lives, I think we can then have an honest conversation about how to deal with the potential for problematic issues that occur with that use. So I'll pause there.
Thank you.
And go ahead, Emily.
Is that okay?
No, go ahead.
So, thinking about all that we have done already, and that we used to be sort of, I've been thinking a lot about the Rolling Stone cover, and and Shumlin administration's courage in talking about this, and sort of revealing our cards and our struggles, and then really making plans to do something about it. And how it's not enough anymore, right? That, like, we did some really great stuff and the world has changed around us. And so in talking to someone local in my community who has been working on these issues for a really long time, in a medical capacity, he was saying that he really thinks that he's seen a decrease, that, like, we're actually on the other side of a wave. But what's happened is, on the other side of, like, in terms of new people sort of coming into really intense use. But on the other side of that wave, what we've seen is a hub and spoke model that doesn't work the same way it used to, because a lot of the services have been privatized and are not collaborating with each other at the community level, are much less accessible because of that. And because the drug supply is so different, with a much shorter high, that causes, a need to go out and find more often, and much less safe. And so the impacts, like, all that we did was good, And we need to sit back down and say, like, what do we need to do to make this really meet the need that we're sitting with right now of a very different drug supply and a very different medical environment available to us.
Yeah.
That's what and I've been really like in the midst of that, and in the midst of like some really intense rhetoric and fear that we're seeing all over the place, that I think in some ways in sort of our more lefty liberal environments like Burlington and Brattleboro, I think sometimes our sort of do-gooder impulses keeps us from having the kind of honest conversations that we need to move through our fear and talk about our fear well enough to get to real solutions. But I am heartened to see that the legislature does seem to be sort of continually, as people recognize the impacts on their own lives and the lives in their communities, I see people really actually showing up to start shifting what we're thinking about.
Yeah. I just wanted to, is it okay to just?
Yeah, no, that was like a non-question. It was a prompt for
No,
you again.
I don't know. The two things, one on drug supply. I mean, that's the best example. The dangers of our drug supply are astonishing right now. And the dangers were increased, if not directly caused by the war on drugs, by criminalization. So when we went after poppy growers, the people went from heroin to fentanyl. And then we're going after the fentanyl labs, and they go from fentanyl to xylazine, and there's an adjustment there. Stimulants now actually are one of the biggest. Folks are shifting to smoking stimulants. Meth and crack and other have resurfaced. So if we want to have these conversations about the harms, we should look at where those harms are coming from. One thing that I think hopefully we can all coalesce around are policies that have, positive impacts both on the sort of concerns of the community, and don't get me wrong, needles in public and people consuming in public, there's dangers associated with that. The dangers to the individuals consuming in an unsupervised environment probably is the highest danger. And so for those 266 people that were lost in Vermont, I mean, they are facing the most danger out of anyone in the community. So hopefully we can coalesce around some policies like overdose prevention centers where, that can address some of the concerns around having needles in the community, having people consuming unsupervised. I know in On Point in New York, where they're operating a overdose prevention center, they've collected 2 million pieces of hazardous waste since they've been operating, and they've reversed over 1,100 overdoses. The vast majority they've reversed without ever calling EMS. And so, that's another issue, but the tax on our EMS and first responders, are there policies that can both create actual safety for individuals that are consuming drugs and safety for the community, and these sort of quality of life issues that folks have talked about get at all of those? And I think there are, but we have to do it from an approach where criminalization is not centered. So.
Mm-hmm. I know you need to leave soon, David. So we have just a few minutes before that needs to happen. So I want to make sure we focus on, you've mentioned a few things that other communities are doing, but where would you like to see Vermont start? Are there specific policies that you'd like to see implement, or you feel should be implemented, or other policies that should be done away with that we're working with now?
Yeah. Thanks for the question. Well, we've started last year. We passed and implemented a drug checking bill, which would allow legislation, which would allow people to come and get drugs checked to make sure that there weren't deadly doses of fentanyl or other things in the drug. That's a start. This year, we're going to be having a conversation, I think, a robust one. It's already on the verge of, I think, getting through the House around overdose prevention centers and what that looks like. I think we're hopeful that that's something that can make it through and communities can start utilizing those to address a lot of the things that we've spoken about. But I think overall, the end goal that maybe for a safer community is to do what countries around the world, and actually what the UN has recently called on, is to look toward the decriminalization of drugs, the destigmatization of people that use drugs. Portugal has done that to great success. Oregon, I almost am loath to talk about Oregon, but I'm actually not, because I just came back from a conference armed with lots of good information about what's happening in Oregon. We see all these stories about, they decriminalize and overnight the entire society collapsed. And it's like, no, our society is collapsing in these ways. People lacking housing, people lacking work, people lacking, supports in their lives. That's happening in Oregon, and it's happening everywhere. It's happening here. It's happening in places that have very criminalized focused drug policies, and less so. But what is happening in Oregon now, as a result of Measure 110, is there's an infusion of $300 million a year in cannabis money that's working on helping people get housing, helping people get job support, helping people find treatment. They are working on the issues from an honest perspective, and I think if you look to places like Portugal, where in 2001 they decriminalized all drugs, and they have seen a massive impact in terms of reduction of harms associated with drugs. And we're seeing that all over the world. Spain, Germany, Italy, folks are taking an approach which looks at the evidence and says that at the end of the day, criminalization causes more harm. So I think ultimately that's the conversation we need to have, with these really positive incremental steps towards that.
David, how does safe supply fit into that? So I think when people imagine decriminalization, they imagine drug dealers driving around, taking over the city, right? And sort of all of the sense of danger that's looped into that. And I think about some really incredible prescribers in our community who are willing to sit down with folks who are using and saying okay, what is the dose of buprenorphine or methadone that you need? And how do you need to balance that with maybe some cannabis to make sure that you are able to moderate yourself throughout your day? And I've heard from some prescribers that in some cases they know that's not enough, that they know that some folks a consistent supply of an opioid, a prescription opioid, would make a difference for them to be able to manage their life in a way that really did reduce harm in their community and for their loved ones. How does that fit into the conversation around decriminalization?
Yeah, I think that's an important conversation to have. I think there are places in the world that do heroin prescribing. They prescribe synthetic heroin which is Dilaudid. And for people that have continually failed on methadone, or I don't know, maybe fail's not the good word, they're unable to maintain where they want to be in their lives on methadone or Suboxone or other interventions, I think that should be an option. It's just what works for people to keep them safe should be the orientation, I think, that we're looking at, because when somebody's safe and their lives are stable, we're all better off, because we're all connected. If we just took alcohol and cigarettes and applied the punitive approach that we do to other types of drugs, imagine what the conversations we would be having. Forced treatment. Daniel was talking about AA. Imagine everyone who had problematic alcohol use was forced to go into a drug treatment program, an alcohol treatment program would that work? No, we've shown that absolutely doesn't work. But the safe supply issue is a big one. And I think it's really important conversation to have, and we should be having conversations about whether heroin maintenance or Dilaudid maintenance or medical maintenance makes sense for people that methadone and Suboxone doesn't work for. And then ultimately we should have people, and that's why decriminalization is so important. We could have a drug checking program which says that, you know, you're not going to be arrested if you come and get your drugs checked, but still within the auspices of a criminalized system, people feel that stigma and that concern and that fear. They could lose their housing, they could lose their children, they could certainly lose their job. And so once we get to a point where we acknowledge substance use disorder as a medical condition and not something that people need to be criminally punished for, we can have those conversations like, yes, you can go get your drugs checked to make sure that you're not going to die, your friends aren't going to die if you consume these. You know, it's the same thing when alcohol was illegal and bathtub gin and, you know, moonshine and people were dying and going blind. You know, it was the policy of prohibition which caused that, not the substance itself. So
David, thank you. I realize we need to let you go. So I'm just going to say, David Mickenberg, thank you so much for being with us. And he is from the Drug Policy Alliance, which I will put their website in the show notes if you want to check out their work. Any thoughts you want to leave us with before we go to break, David?
no, I'm so thankful for being here and having this conversation. I think we should, you know, I think this conversation needs to happen all over the state. And I'll say yesterday we had an event. It was a webinar that around rethinking drug policy in Vermont, and we were so hard. And we heard from leading experts from all over the world, all over the country about these issues. And we had, you know, 260 plus people sign up for that, and we had, you know, a really robust and interesting conversation about the evidence around these issues. So I'll just also give a little plug. I'm also working with a coalition of folks called Decrim Vermont, and it's decrimvermont.org, where we're having, you can see all the conversations that are happening around these issues in Vermont. And hopefully I can get a copy of this because I want to hear more of what Daniel is going to say, because I'm sorry I have to leave, but this has been a really, really great conversation. Happy to come back anytime.
Thank you, David. And on that note, we're going to hear from some of our underwriters on WVEW 107.7 LP Brattleboro, your community radio station. So hang tight. We'll be right back. Welcome back to the second half of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. If you're just joining us, I'm your host, Olga Peters, and I am speaking with regular contributor Emily Kornheiser, one of 3 reps from Brattleboro, and Daniel Quipp, who is a select board member in Brattleboro. And we've been talking about drug policy in Vermont. And before the break, we had David Mickenberg on the show, who shared with us some of the policies in Vermont that maybe aren't helping folks who are dealing with substance misuse disorder. Emily, no, actually, I want to start with Daniel, if you don't mind.
Please do.
You know, having listened to David's conversation, as someone who puts policy into place at the select board level, anything come up for you? Any thoughts, any aha moments?
Yeah, I mean, there was a lot, and I'm glad I took notes and circled a few things. I actually don't want to talk about policy just yet.
Okay.
I want to talk about like culture and attitudes, because I think
really appreciate that, because I'd love to even like bring in some of the select board conversation we had the other day.
Yeah.
Mm-hmm.
And you know, I'm not here as a policy expert.
Yeah.
I'm not an expert in any of this. I am simply a person that is concerned and wants to do better.
I would add to that, you're someone who has shown up.
Yeah.
Which means you've shown up at the conversation and you've shown up at the policy table. And I think that's something that deserves acknowledgement too.
Yeah. Okay. Thank you. You know, so one of the things that David said was this phrase, these people or those people. And that is like a huge piece of it as far as I'm concerned. You know, there is a othering that occurs. and I see it in Brattleboro play out in a kind of discomfort around people who look, I don't know, unkempt. They are exhibiting signs maybe of addiction. We actually don't know anything about those people's lives, and we live in such a small place, and with some kind of curiosity we could know. Not everybody needs to know, frankly, but like, you know, we could be doing a better job at being curious about what's actually going on with people, and instead of pushing them away to our edges, which is really what that is all I hear from people, you know, get it out of my way, get them out of the way, you know, or a kind of magical thinking of, well, maybe they'll all just go away, right? And one of the ways that people will go away is they will die, because we didn't care enough for them, but they will be replaced by somebody else, and that somebody may well be your child, your cousin, your friend, and all of these people, right? These people in our town who, and in our state, right? Because what David's talking about in Billings, it's the same here. And it's the same in Rutland and the same in Bennington. It's, you know, there's nothing special about any of these places. It's the same problem. We need to like stop saying these people and understand that these people are our neighbors, and they are, I mean, I think it goes back to that sort of cheesy, like, you know, somebody's mother, somebody's, you know, son kind of thing. But that is true. And you do not have to, I mean, we've already spoken about it here, that you each have, and I have, people in my life and your lives who are wrestling with either use that is harmful, or use that is, you know, an addiction that's out of control, or use that is like, because of some policies, right? Like use that is not really supported and can't really be done safely, you know? So like I went to the 99 restaurant yesterday for a beverage and some boneless wings. I didn't expect them to be boneless, and that was a bit of a surprise, with a friend, because that's where like socializing occurs, and everybody was well supported and safe in imbibing substances that, you know, contain alcohol. And I had a Diet Pepsi. It was not very exciting. But what's my point? My point is that, like, you know, we already have, this is maybe a little glib, but like we already have safe use sites for things like alcohol. And we have regulated supplies, you know, that's true of tobacco as well. And, you know, the way that the cannabis industry is sort of you know, unfolding in Vermont is kind of interesting. And so, you know, David talked about like the difference between how we treat people who are using illegal drugs and how we treat people that are using legal drugs. And those are policy decisions, and they're not policy decisions really that I feel like the Brattleboro Selectboard has much of a role in, you know. They might be state level decisions, but David was even talking about some federal policy that, you know, okay, so you go after the poppy growers, right? And then we move to synthetics, and then you go after this kind of synthetic, and so things shift. I was having a conversation with the person that runs the drug checking pilot program at the AIDS Project of Southern Vermont the other week, and the way in which he spoke about how, you know, the chemical composition of things gets altered just enough, right, to stay ahead of what is possible from the regulatory point of view, right? Like we are being impacted by policy decisions that are made far away from us, and we don't get the opportunity to unravel those policy decisions, you know, even with our one congressperson and 2 senators. So I don't know, that these people thing is a huge piece of it for me.
You know, I love that Emily before the break brought up the Rolling Stone cover, which I think many of us in Vermont may remember, of the person with the maple sugar bucket, and I think the IV, or they were shooting up. And going back to what you were talking about with culture and those people, I thought that cover was always so powerful, because what it was really commenting on was, oh, but this is nice, picturesque postcard Vermont. Emily, we've talked about this before. You know, pretty things, such bad things don't happen in pretty places. And that sense of, if we don't see it, it's not there, or it can't happen here, it can't happen now, it can't happen to us, kind of thing. And the pushing people away, you know, trying to push things back in the shadows or out of sight. So we have the pretty postcard again, and how that just doesn't work. And so I just think that's such a great visual representation of everything you were just saying, Daniel. And our own, I'll add to that, and our own expectations of what a community should be, quote unquote.
I haven't cried on the happy hour in a little while. And so thank you, Daniel, for that. For really just like anchoring us back in who we are and what we're doing here, and who we love. You know, a whole generation of kids in our town have experienced just like massive losses of loved ones and peers. And, you know, my generation has experienced a massive loss of children, and nieces and nephews. And you know, I've certainly had folks in my life with significant challenges with alcohol who are not in my life anymore, because I just couldn't handle the impacts. But they're still alive, and still in community. And this, you know, I think you said it, we were at a select board meeting together on Tuesday night, where I think you really brought these issues into stark relief in a way that you just did for us now. And I really appreciated it. You mentioned there this phrase that's sort of gained some currency, and I think is really at the core of this, which is, you know, the opposite of addiction is connection, right? And what it takes for us to really move past, like, what does it take for us to move past our biases and connect with each other and see each other as human and deserving of the same care. And I think one way that happens is we're individually impacted in a devastating way. And I would rather that not be what it will take for each of us to move into connection and community. I would rather it be something softer, like a meaningful conversation, or, you know, reading a book, or just, you know, being able to take the time to think about what we are really afraid of, and examine those stories, and really get to these, you know, I think what we try to do here on the happy hour is dive into the sort of the story behind the problems, the stories behind the policy, and see what are real policy solutions that make a difference, rather than policy solutions that are responding to our core instincts. Because I think sometimes I know I can't trust my own instincts when they're being driven by fear. And I hope that's sort of how we can go forward with this. And I think that's a big role that the select board can take, is really being the conversation holder, rather than the policy provider, right? And I don't think, you know, we've had other conversations here on the happy hour about how hard it is to have a conversation with Robert's Rules of Order. So I don't think those conversations necessarily happen at select board meetings. I think they happen when community leaders say, we need to talk about this with each other. And then those conversations happen at the library or the fire department, or, you know, over some bagels, or on a street corner, you know. But I think these conversations about sort of who deserves our public space and what it means to use our public space in a way that meets everyone's needs is certainly the purview of the select board.
Mm-hmm. Yeah, I mean, before the pandemic, we had an event at the fire department that was about the opioid epidemic. And it was a sort of, what do you call it? When everybody's sitting behind a table and there's a bunch of experts. One of those things.
A panel discussion.
A panel discussion, that's right.
Okay.
I was not behind the table and an expert because I am not an expert. But there were people from healthcare settings. There were people from organizations like Turning Point. There were people from the retreat. And that was that feels like a long time ago. It feels like a lot has changed. And I'm not sure actually that much actually has changed. Yeah.
Agreed.
Yeah.
But I agree that it also feels like a lot has changed. Sorry to interrupt you.
Yeah, no, it's true. And so that was convened by the town, right? I'd imagine it was largely convened by the town as a reaction to people speaking to, say, the town manager or the select board about their concerns. And typically we hear from people at the select board level who have, you know, a fair amount of comfort and power and privilege. We very occasionally do, and it's actually very impactful when that happens. But, you know, we're not typically hearing from people experiencing homelessness. We're hearing from somebody who saw somebody experiencing homelessness and didn't like it. And they didn't like it because it was like messing up the place. They didn't, you know, they weren't upset that this person doesn't have a home. And that's kind of like the way in which we hear about drug-related stuff as well. We're not hearing from, you know, drug users saying, I need something from the town. We're typically hearing about like the way that folks are impacted. And that is a moment where I need to kind of like take a bit of a breath and examine my own biases and reactions to things. And that's, you know, I am one person on a 5-person board. And, you know, I think it's important that it's a 5-person board and that there's a range of perspectives on there. And I also think it's important that each of us shows up in a way that is very honest. And, you know, we all took an oath to really kind of do right and equal justice by all the folks in the town. And also there are some of us that have constituencies that feel more, you know, that you're more connected with. And my work as, you know, my actual day-to-day job is working at SEVCA, Southeastern Vermont Community Action, which is the designated anti-poverty agency for Wyndham and Windsor County. And I didn't just fall into that work because something random happened. Like, I care about economic injustice. I care about making sure that the folks in our community who have the least are really being heard and supported. But that's not who comes to public participation at a select board meeting. And so it's hard to think of what the mechanisms are for actually, you know, I talked earlier about having curiosity about folks in our community around drug use. And like, you know, we're going to hear from the people that are impacted in a way where they are, say, like, you know, upset about finding needles in a public park, right? We're going to hear from those people, and we need to hear from them, and we need to listen to them, and that, you know, what they have to say is real and important and needs action, and usually does get action. You know, we have a Parks and Rec department that cares about having clean parks, and so, you know, knowing that is important. But we don't typically hear from people on the other end of the spectrum. And
you know,
figuring out ways to do that would be good.
Yeah, and I also don't want people to need to sell their humanity to other people in order to get their needs met, right?
Mhm.
And so I want robust public participation from everyone in our community. I want folks without economic privilege or social privilege to feel like they have a right to participate, and they'll be listened to. And I don't, you know, I don't want everyone who is marginalized for whatever reason to feel like they have to talk to, like, every random person that walks up to them and tell them their life story so that they can get their needs met. That's just like a very localized version of poverty porn, right?
Mhm.
So that's also like, how do we even bring humanity to the process of bringing humanity to people? I think is a little bit of, maybe I'm overthinking it.
I understand what you're saying. I mean, like I say, it is very impactful when somebody who doesn't have a lot of power and privilege comes to the select board meeting and tells us something that's maybe a little messy.
Mhm.
Doesn't happen often. And they are kind of putting themselves out there, and they can be a lightning rod for society's kind of feelings about that problem. That your feelings about drug addiction largely are now given a focus of an actual individual, and that's a tough position to put oneself in.
Mhm.
We had the community safety review process that did unearth some information about this. We have not really been able to make good progress with the recommendations from that process, for a number of reasons, but we committed this year to finding a path forward on community safety. That was a goal that all 5 select board members got behind, and we're currently working with some folks from the state, Jim Baker, who was kind of dispatched by the governor, I think, to come down here and look into.
We specifically passed legislation to create Jim Baker's role.
Well, that's great. Thank you for letting me know.
Yes.
And so Jim is currently doing some work that I'm not super aware of, that is moving towards something that is looking at issues of safety, but from a kind of public health kind of lens, really.
Mhm.
And I'm
Nice.
hopeful that when we kind of get connected with that work, because I know that it is sort of beginning already, and I have asked the town manager to loop me in because it's something that I really care about, and I'm like ready to play an active role in that process. But I hope that we can kind of find ways to start having conversations that don't rely on an impacted individual coming and unburdening themselves of their entire personal history of tragedy.
Mhm.
And I would say, Jim Baker is a police and criminal justice professional. He is not a public health professional. And I think the folks who led the community safety review process are community health professionals and participation professionals. And so I hope we can really weave together those conversations in a way.
That's what I hope too.
We all do, right? We all do our work based on, and we are all living our lives based on the history and the experiences that we've had. And that's what we have in common, that we're all sort of like constantly evolving and shaping our lens based on what we've experienced. And so we need lots of people in a conversation in order to make sure we're seeing the big picture.
Mhm. We are just out of time. The conversation always goes really quickly, but I want to leave the last word with Daniel. Having heard this conversation, the next time you go back to the select board, is there anything you would want to bring up or do differently going forward?
That's an interesting thing, because the next time I go to the select board meeting, there's an agenda that I didn't set,
True.
you know? So the question is, how do you put this stuff on an agenda? Or is there a conversation that needs to be happening, you know, with the town manager, you know, and maybe with one other select board member? But I want to come back to something that David said. You know, he's talking about evidence-based approaches, right?
Mhm.
So like, let us be guided by evidence-based approaches. And he also asked a question, you know, what is happening in Oregon, right? Like,
Mhm.
I had an impression of what is happening in Oregon from a New York Times article from a couple of months ago. I have a very, you know, rough impression of like what happened in Portugal, and like he talked about Spain and Italy and Germany, and so we need to be curious about like other approaches that have been taken elsewhere, you know, and at least the approach in Oregon and the approach in New York, with the, you know, overdose prevention site, like they are within the same legal system as us. And so as a, you know, a select board member is not a professional. I have a full-time job, you know, so we need to be gathering evidence and, you know, learning about it together so that we can then understand approaches that we might take here. I do not have enough information right now to be able to make good, sound decisions.
Thank you. Daniel Quipp from the Brattleboro Select Board. It was really wonderful to have you on the show today. Thank you so much. Emily, if folks want to learn more about you, where can they go?
Folks can go to emilykornheiser.org and you'll find links to connect with me in a wide variety of ways.
And we want to thank Brattleboro Community Television for helping us get the video version of this podcast up on the airwaves, as well as WVEW 107.7 LP Brattleboro, your community radio station. You can find us there Fridays at 2 or rebroadcast at Wednesdays at 8 a.m. Hey, everyone, have a good weekend. Take care.
Thanks, Olga.
Thank
Thanks.
you.
Bye, everyone. Thank you.
Bye.